Okay, so here we're going to look at some nerves, and I'm just going to go by what we can see. I'm not going to go down the list. I'm not going to go individual nerve by individual nerve. What I'm going to do is I'm going to show you what it's going to look like when you're in a practical situation, okay? So for orientation purposes, again, we're looking at the lateral side of an equine head. The masseter and mandible has been removed, showing the stylohyoid bone, as well as the linguofacial trunk artery, which we've already gone over. If we look running parallel to and right next to the linguofacial trunk artery, we have a very large nerve that's running laterally over the external carotid artery. That very large nerve is going to be the hypoglossal nerve that's supplying motor innervation to the tongue or muscles of the tongue. If we look again in the area overlying this, we have a few other nerves, including this one that's been cut. So again, this nerve that has been cut and this artery that has been cut would have been going into the mandibular foramen. So that's the inferior alveolar nerve and artery. We also see this nerve right here that's going straight down into the tongue. That is the lingual nerve. And finally, the third branch of the mandibular, because all of those are branches, so the lingual, inferior alveolar are branches of the mandibular nerve. The only other one that we would see over here is we actually see has been cut, but is right here on the mylohyoid muscle. That is the mylohyoid nerve. Another structure that I want to bring to your attention is a very tiny nerve that is coming in and almost acting like a communicating branch. We see it right here, this small nerve that's coming in and joining with our lingual nerve. This is actually a branch of the facial nerve, and this is specifically the chorda tympani. And this is a continuation of the intermediate nerve from the facial nerve. The next nerve that we can see is again another branch of the mandibular nerve, which is the buccal nerve. Finally, if we look up into the pterygopalatine fossa, just ventral to the orbital contents, we see this very large nerve right here, which would be the maxillary nerve, exiting the rostral alar foramen, along with the maxillary artery. It's then going to give rise to a few nerves, including the pterygopalatine nerve, which is giving off the minor palatine nerve, which is running with the minor palatine artery, as well as the major palatine nerve, and then in here as well would be the caudal nasal nerve, and it's going to be difficult to see that since we don't have this area opened up. But another great place to see the infraorbital nerve is by cleaning out some of this area down here and kind of moving the levator nasolabius alis out of the way. You can actually see a very large nerve exiting that infraorbital foramen in this area. I strongly recommend you see what the infraorbital nerve looks like coming through that infraorbital foramen. Okay, so we're going to flip this head over and look at a couple of the medial nerves that we can see in this area. So just for orientation purposes, again, we're looking at kind of the area of the guttural pouch. It's been cleaned out and opened up, allowing you to see a few different nerves. First off, you see this nerve right here that is exiting the skull and coming directly ventrally and running right next to this stylopharyngeus muscle. If you see a small nerve running right next to the stylopharyngeus muscle, most likely that is the glossopharyngeal nerve, specifically the lingual branch of the glossopharyngeal nerve. Next, we can see our vagosympathetic trunk. And if we follow it far enough dorsally, we can see the separation of the cervical sympathetic trunk, leaving the vagus nerve continuing dorsally, and the cervical sympathetic trunk connecting with the cranial cervical ganglion. So that's this very large ganglion right here. Cranial cervical ganglion, vagus nerve just caudal to it, cervical sympathetic trunk, joining with the vagus nerve to form the vagosympathetic trunk. So that's cranial nerve 9, glossopharyngeal, cranial nerve 10, vagus, the sympathetic portion to everything in the head. Next we have this nerve that's going caudally towards the muscles of the neck. That's going to be the accessory nerve. And we already talked about cranial nerve 12, or the hypoglossal nerve. That's going to be this very large nerve traveling laterally to the external carotid artery. Coming back to the vagus, we see this branch of the vagus nerve right here that's moving ventrally from the vagus nerve and down towards the area of the larynx. That's going to be the cranial laryngeal nerve. Let's go back. We already talked about oculomotor, which is cranial nerve 3, innervating the muscles of the orbit, or the extraocular muscles. We talked about cranial nerve 4, the trochlear nerve, innervating motor innervation to the dorsal oblique muscle. Cranial nerve 5, or the trigeminal nerve, is made up of the ophthalmic nerve, which we've talked about its branches, the maxillary nerve, which we just discussed, and the mandibular nerve, which the branches, again, we've already looked at. Cranial nerve 6 is the abducens nerve, and that is going to be best seen running into the kind of deepest aspect of the lateral rectus muscle. And that brings us to cranial nerve 7. So here we're going to be looking at some of the branches of the facial nerve. So the facial nerve is supplying most or all of the motor innervation to the mimetic muscles, or muscles of facial expression. So these really large white structures you see right here running along the masseter are going to be buccal branches of the facial nerve. The mandibular marginal branch of the facial nerve in the bovine would be running right along the masseter muscle. And it's going to be running right with this structure, which is the parotid salivary duct. The other branch of the facial nerve that you need to be aware of, I don't see that it's opened up here, but it would be a nerve that would be running right over top of the zygomatic arch, coming to the area just dorsal to the eyeball. And that is going to be the auriculopalpebral nerve. That's the nerve that you're going to have to use some local anesthesia on to block if you're planning on doing any surgery in the eye or orbit itself. There are some other branches of the facial nerve. Unfortunately, most of those don't usually survive dissection, but the facial nerve itself is going to come out just on the rostral edge of that parotid salivary gland. Cranial nerve 8 is the vestibulocochlear nerve. That's going to stay pretty much, it is going to stay totally inside the petrosal part of the temporal bone within the inner ear. Cranial nerve 9 is glossopharyngeal. So at this point, we've pretty much seen all of the cranial nerves, or discussed all of the cranial nerves, with the exception of the olfactory nerve, cranial nerve 1, and the optic nerve, cranial nerve 2. If you have questions on any of those, just let me know.